Good morning, everybody. It's a pleasure to be here. Thanks again for coming out. We're going to start just with these couple questions, and then we'll kind of dive right into the PowerPoint. So what is heart failure self-care management? A, taking medications as prescribed. B, following your treatment plan every day. C, weighing yourself daily. Or D, all the above. Look at that. That's pretty good. Any questions? I think I'm done. So we'll kind of go over this, but yes, all of that together. Second question, how should you track your symptoms at home? A, write daily symptoms in a journal. B, check blood pressure and heart rate daily. C, check your weight daily. Or D, all the above. Almost there. That's good, though. Yes, everything. So we'll dive right in. What is self-care? You guys have heard this all day. Self-care is essentially managing your health by following your treatment plan every day and contributing to the treatment plan. It's fully taking charge of your heart failure. It's knowing your exact diagnosis with the specific ejection fraction. I know I heard that question earlier. It's taking your meds every day as prescribed, knowing the reasons why each med and your eventual goal dose, knowing your appropriate diet, including fluid and salt restrictions, weighing yourself, avoiding alcohol or drinking sparingly, taking your blood pressure daily and knowing what your goal blood pressure should be, and then taking care of your other diagnoses. We talked about this earlier, your COPD, your sleep apnea, hypertension, cholesterol, things of that. And ultimately at the bottom, success depends on everybody's active involvement, not just passive compliance. Learning your body. Everybody's body is different. Nobody knows their body better than you. Everybody experiences signs and symptoms of heart failure differently. And this is, again, some of the early signs and symptoms like you guys may have seen before. Weight gain 2 pounds in a day or even 5 pounds in a week. Again, little trends throughout the day is okay as long as from a day-to-day 24-hour point, you maintain about the same. You can have swollen the legs, the feet, the hands, the abdomen, worsening cough, and chest congestion. You may have to start using extra pillows behind your back to sleep at night to kind of relieve the shortness of breath. Loss of appetite. Again, low or high blood pressure, confusion, restlessness, some short of breath, and dizziness or lightheadedness. Partnering with your provider. I think this is one of the most important things you guys can kind of get out of the entire seminar today. Really partnering with your provider, partnering with your physician, and be sure to ask these common questions. What is my heart condition? What kind of heart failure do I have? What is my specific ejection fraction? What's my dry weight? And what are my specific signs and symptoms that I should be monitoring at home? As you discuss your plan with your doctor, you need to develop a treatment plan. We want to keep the fluid off. We want to maintain adequate blood pressure. And we want to, one of the key parts is to continue increasing your medications as tolerated. And ultimately, by doing this, everybody's plan is going to be individualized. Nobody will really have two of the same plan. So flogging the heart. This is just a quick picture of essentially what your heart goes through as it gets weak. Your body is still whipping the heart down, trying to get it to do what it used to do, and your heart just runs out of energy. It's just being flogged too much. So there are, as you guys know, medications that can help with this. Right here, we have two sections, your low ejection fraction, which again is reduced ejection fraction less than 50%, and then your normal ejection fraction, which according to textbook is preserved over 50%. If your ejection fraction is under 50%, you're going to be on these set core medications if you can tolerate these. And by being on these medications, I just want to emphasize that they block the harmful effects that your body is having on your heart. One of the three, beta blockers, which decreases your heart rate and enables your heart to work less. Your ACE inhibitors or angiotensin receptor blockers, these lower your blood pressure to maintain less strain on the heart. And then you have your aldosterone blockers. They trigger the body to remove excess sodium, which thus lowers the volume of blood that your heart is pumping. And for those people who have the type of heart failure with the preserved ejection fraction, again, we're looking at to try to control the heart rate, lower the heart rate, help the heart pump better, relax a little better. And then we want to focus in on treating the key, your other conditions, your hypertension, your diabetes, your coronary artery disease, your COPD, so on and so forth. Both of these, as you guys see, we can use diuretics for each of them to try to keep the fluid off. Other medications, other options that are out there. We have nitrates, which reduce the pressure that your heart has to pump against. We have digoxin, if you guys are on that, increases the strength of your heart muscle contractions. And in some situations, we even have intravenous medication called inotropes, which are used to help improve your heart pumping function and to help maintain your blood pressure. Common side effects of all these medications, just something to kind of keep in mind. This is not every side effect that you guys may have, but it's a start. And knowing what they are will help enable you guys to be able to handle these side effects. Low or high blood pressure, obviously we're going to adjust medications. This can be from fainting, dizziness, headache, things such as that. Specifically, diuretics can cause cramping if your electrolytes get too low. So an easy solution is to eat an extra banana, take an extra potassium capsule, and then as you guys know with the diuretics, if you're always feeling thirsty, instead of just drinking a lot of extra water, there are ice chips. Try giving those so that you're not taking in so much extra volume. Treatment plan obstacles. This was somewhat touched prior, but barriers to any treatment plan, it's good to tell your physician, your provider, if you have these barriers, because we always assume everything is peachy, everything is 100% the way it should be, right? And we all know it is never like that. Let us know if you forget to take your medications. Let us know that you don't like specific side effects of medications. Let us know about the financial burden for these medications, the lack of energy, and then even your inability to cook the foods that we recommend here. Overcoming a lot of these barriers, we can, if we're able, we can provide or prescribe less expensive medications. We can help find combination of these medications with less side effects for you guys. We can suggest some cooking classes. There are a lot of options out here in the community with the hospital, without the hospital that are there for you. But again, the key component of this is at the bottom. Just have that open dialogue, have that open communication with your provider. So what are a few things you guys can do at home? Again, early communication to establish your treatment plan. Even if it's 10 years down the road, it's a good idea to let us know what your long-term goals are. Take your medications as prescribed. If you have low or high blood pressure or even low or high heart rates because of some blood pressure medications, we can adjust it. Just let us know what happens, especially as we're titrating up or titrating down. We don't know how these medications are affecting you. You guys have to let us know. Every day, write your symptoms down and rate them on a numeric scale. I saw scales earlier out here at the tables, 0 to 10, 0 being bad or good, 10 being not feeling very good. Check your blood pressure, heart rate, weight daily, same time every day in the morning. And then let your provider or nurse know if your symptoms are improving or worsening. Last, SelfCheck Plan. This is just an example of what's out there for you guys. It has real good green, yellow, and red zones where you guys can be. If you're in the green zone, you know you're doing well. If you creep into the yellow zone, start paying attention. And as you hopefully this never happens, but if you move into the red zone, that's when you should be calling us for help. This is an example of one of our heart failure zones management pieces of paper that I think is available out there. You can see, again, it's kind of broken up between green, yellow, and red zones. Green is where we want you to be. Yellow, call your physician if you start going into the yellow, and then obviously in the red again, call us if you're going in the red and you're staying in the red zones. So in conclusion, for self-care, people with heart failure can live normal lives when taking charge of their heart failure. Taking your prescribed medications, monitoring your symptoms, and early communication is essential for everybody. Thank you.